Dr. Bruce Shannahoff joins us every week at this time. Doctor, maybe I should ask him what's going on in my throat first. Bruce is one of the 4 medical experts that we have on the program during the course of the week. One of the things that I like about him, other than his ability to fix my back when I'm in California and do a great job of it, his chiropractic website is 818newback.com, 818newback.com. He also has a very sage mind and understands things that I think a lot of people need to have a second look at, or listen to, if you will. I'm just thinking about, I've in the last 5 or 6 minutes, Bruce, lost my voice, as it seems to be, it's the worst time, although now it seems almost all the time I have this phlegm in my throat, but I just couldn't talk a minute ago because of the, I'm guessing that it's all of the things that are in the air. But what else? Do emotions ever get into people losing their voice?
Oh, absolutely, Doug.
Really?
Emotions and stress play a major role in, manifesting into physical types of symptoms. I tell you, gargle with some salt water. And,
all right. I'll do that. Thank you.
And rest after the show, because obviously
there we
you're
go.
talking for hours and hours.
Yeah, not much chance of that. But at any rate, let's get to what's between the lines this week from your perspective.
Well, today you're always so nice talking about my practice, but I'd like to talk about the centerpiece of my practice, the non-surgical spinal decompression technology. Now, it's abbreviated NSSD, and what non-surgical spinal decompression is it's a non-surgical technology for the restoration of bulging, herniated, and degenerative discs. And, true spinal decompression utilizes these machines with high-speed treatment computers to calculate and monitor the spinal decompression treatment curve for each patient as it's happening, which is to say that these are very expensive machines costing, $100,000 and up. But the benefits are that it relieves or eliminates spinal pain due to herniated and degenerative discs. It improves the hydration of the spinal discs, which is very important to their health. It reduces the herniations of the bulging, and it strengthens the ligaments in there. And the reason this is so important is because standard medical care for these kind of conditions is typically epidural cortisone injections, surgery, and then finally the endpoint is opioid pain management. And this leads to 16,000 deaths per year from opioid prescription painkillers. It leads to $40 billion a year in surgeries and $60 billion a year in lost productivity. Wow. And NSSD can solve the same problem at about 5% of the cost of a surgery.
So can I ask a question, Dr. Bruce?
Yeah.
Okay,
sure.
So I was telling the boys earlier, I've come up with this weird QVC home shopping network obsession, and they were selling an inversion table last night that you can do at home. Is that safe, and does it even work, or is it better to find a place like yours that'll do this for us and we don't fall on our heads?
As far as safe, inversion can be a problem because it increases the intracranial blood pressure of the individual. So someone who would be susceptible to having a stroke could initiate an inversion. But the key thing is that while it may manipulate the spine a little bit, it does not produce the negative intradiscal pressure that is a part of non-surgical spinal decompression. The technology is unique. Traction doesn't create it. Inversion doesn't create it. There's no other way to get that negative intradiscal pressure that restores the disc other than through non-surgical spinal decompression.
All right. So the essence of this is you need more education, certainly. When somebody says you need an operation, you need to stop there and don't start there and find out what the other alternatives are. And that's exactly good information in and of itself from Between the Lines. Dr. Bruce Shannahoff, website that gives you more information about what he was just talking about, 818newback.com, 818newback.com. Bruce, thank you. Good to have you here.